2, 3.
Hello, my name is Yasmin-IVPB, and I'm going to be demonstrating today how to administer an IV piggyback. And the medication that I'm going to be demonstrating today is metronidazole or flagyl, which is an anti-infective. And so first, before I do anything, I've gone into the medication room and I've compared my MAR with my medication, and I've done my first 2 checks. And I would do the 3rd check at the patient's bedside, and I've also went through my 8 rights of medication. So I have the right patient and the right medication. So when I come into the room, I'm gonna have my MAR bedside, and then I'm also gonna have my medication. And I'm gonna do my 3rd check by looking at the patient's wristband. So I'm gonna have the patient verbalize their name and date of birth. So the patient has done that aloud, and I have the correct patient. And then I'll also check the medication with the MAR, so I have the right medication. And once I've done my checks, I'm gonna go ahead and, of course, sanitize my hands before doing anything. And then I'm also gonna be checking the patient's IV site. So I'm just making sure there's no phlebitis, there's no infiltration, swelling, or inflammation. So the IV site looks great, it's padded, and I'm able to administer the medication. So I'm gonna come back to the med. I'm gonna go ahead and start the setup for that. So I'll come over here. And so I'm gonna make sure the line is clamped. Then I'm gonna remove the top off of the medication. And I'm holding my fingers lower to make sure not to touch or desanitize the port. So I'm gonna go ahead and screw that in. And again, it's clamped, so I can hang that up. And then I'm also going to pause the primary. I'm gonna lower the bag. And then I'm gonna go ahead and clean the ports where I'm gonna connect the medication. So I'm gonna go ahead and scrub it or clean it vigorously for 15 seconds. And for the purposes of the video, it's been 15 seconds. Then I'm gonna go ahead and connect. So that's connected, and what I'm gonna do is back prime the metronidazole. So I'll go ahead and open the line. And actually, I'm gonna put my primary up a little higher so it can prime. And then I'll fill it about 3/4 of the way full. Perfect. And then I can go ahead and lower the primary bag. Then I'm gonna go and program the metronidazole. So I'm gonna push channel select. I'm gonna push the secondary. And then I'm gonna find metronidazole. I'm gonna go ahead and select that. And then I'm gonna put the amounts, or the dosage. So I'm gonna administer 750 milligrams of metronidazole in 250 milliliters. And then I'm gonna go ahead and put in the rate volume. And the rate is gonna be 125 milliliters per hour. So I'll go ahead and push start. Then make sure that the line is open. Then I'm gonna wanna look for the first drop. Alright, now I got my first drop of medication, and then I'm just gonna make sure that I trace the line, again making sure everything's open, and then I would put my label on, and it's good for 96 hours, and that'll be it.